What's up, beautiful people? Another day, another study. Type 2 diabetes accounts for the majority of the cases of diabetes, and we know that more than 85% of people with type 2 diabetes are overweight or obese, and body weight loss is associated with improvements in blood glucose, and we can see a complete or partial remission of diabetes with body weight loss. One of the things that really aggravates me is when clinicians say things like, oh, you'll be on this medication the rest of your life. My response is, if you do the things that brought you to the medication, then yeah, you may need the medication the rest of your life. But when we change things up, when we evaluate causes, when we dive into your lifestyle, it may be that we can reduce or possibly eliminate the medication. And this is specifically for cardiometabolic things like diabetes, high blood pressure, cholesterol. So this was a systemic analysis of randomized controlled trials evaluating different weight loss modalities and the probability of remission of type 2 diabetes, either complete or partial, and the definitions for those are down below. They did find that with body weight loss, there was an increased probability of remission of diabetes, and that increased with more body weight loss. So, for example, with a 20 to 29% body weight loss, there was almost a 50% chance of remission of diabetes, and this increased to almost 80% for a 30% body weight loss. That was for complete remission. For partial remission, the numbers were higher at a lower body weight loss percentage. So, for example, partial remission was possible in nearly half of the people with type 2 diabetes at a 10 to 19% body weight loss, and almost 90% of people with a 30% body weight loss achieved partial remission. And overall, for every 1% body weight loss, the probability of remission was 2.17% for complete and 2.74% for partial. And these results were independent of sex, race, duration of diabetes, A1C, insulin use, baseline BMI, or intervention type. So one of the problems, I think, with the healthy at any size movement is that the movement suggests that we focus on labs and fitness as opposed to looking at body weight. But if you have a condition like diabetes, like hyperlipidemia, like high blood pressure, then we may only be able to achieve remission of those conditions with body weight loss. And we know, looking at the literature, that being metabolically healthy and obese is probably a transitory state. We've covered that in previous videos, that a lot of these people transition over to metabolically unhealthy obesity. So if you're someone with type 2 diabetes and you're overweight or obese, it is something to put in consideration if you want to achieve either partial or complete remission, be off medications, that we're going to have to address body weight.